Hello, everyone. It's the last day of July. It's Friday, July the 31st. We're still having a real issue with this killer virus. I'll tell you about that as we go forward here. But now we've lost another 5 West Virginians. And they are, our 112th death was a 74-year-old female from Mercer County. Our 113th was a 49-year-old female from Ohio County. 114th was a 59-year-old male from Logan County. 115th death is an 85-year-old female from Logan County. And our 116th death, and we celebrate this long life, is a 98-year-old male from Raleigh County. Now, our numbers today, we've had an additional 182 positive cases. Now, it is a record high, but we are testing record numbers. We tested 6,183 people, and we have a daily rate that is slightly lower than yesterday or a day before. At 2.94%, it's still too high. We have 1,712 active cases going on, and that's up from 1,647 on Monday. We have hospitalized now 102 people. That's up from 94 on Monday, and if you're tracking, you're on a percentage basis, that's moving at about 10% a day. And it's still well under our capacity at our hospitals, but it's not good. You know, as of today, we have 277 cases in Kanawha County, and that's the highest, and it's up from 254 on Monday. And as I said, we're watching Kanawha County very closely. We're in constant contact with their medical teams and medical people, and they feel confidently that Kanawha County is in stable shape. But at the same time, we're watching it, and we're watching it as closely as we possibly can. Our reproduction number has dropped, and that is that R naught number or whatever, but it has dropped now to 1.00. Now that's good. That's really good, and that's the best that it's been in some time, but at the same time, we had it down significantly under 1. You know, at 1, it's better than a lot of states, but and where we were, at one time we reached the highest of any of the states, which is terrible. But we are doing much better there, but we've got to continue to bring this thing down. Now, and I'll tell you this probably when I sign off today, and I'm telling it to you right now. West Virginia, I'm doing everything in my power. I am doing every single thing in my power, and this juggling act is really tough. It's really tough. It's lonely and it's tough. But West Virginia, you have got to wear your mask. You have got to do any and everything you can possibly do. This thing is migrating from the south, as I said that it would do. And the thing that worries me the very most is just think about this. The numbers in Logan County yesterday now are 20. If you multiply 20 times 55 counties in this state, that's 1,100 in a day. In a day. And we don't have anything like that. We've got 182 in a day. But just think, Logan County's population is minuscule compared to a lot of counties that we have in this state. Well, then what's happening in Logan County? It's coming from the south. What's happening in Mercer County? It's coming from the south. It's coming. What's happening in Kentucky? Kentucky is absolutely shutting down their whole universe over there. It's coming from the south. West Virginia, you have got to listen. You can't ease off. You've got to wear your mask. You've got to absolutely protect the elderly. You have got to absolutely use all the tools in the toolbox to stay socially distanced and on your game. West Virginia, you have been the miracle. I have just read off 5 beautiful West Virginians that we've lost. Now, life is too precious for me to sit here and read of West Virginians we've lost. Please, West Virginia, I am pleading with you, wear your mask, wash your hands, do everything you possibly can. This thing is invisible and it is here with us. It will not be with us forever, especially as we move toward those potential drugs. But today, it is with us, and it can do harm to us like you can't imagine. Don't let your guard down, West Virginia. We're seeing you do just that. We're seeing you do greatness, and we're still seeing people that believe that, well, I don't have to wear a mask, and they're not following the science. They're not following our president. They're not following me. Their father's saying, that's my right. I don't have to do this and everything. Now, if you have a lung issue to where wearing a mask causes you a problem, you don't need to be doing that. You don't need to be wearing a mask, and we totally understand that. But other than that, you can wear a face shield if that be the case. But what I'm just telling you, and I can't tell you any more emphatically, be afraid, West Virginia, and be concerned. Don't be fearful, but for crying out loud, you've got to have at least enough afraid in you or fear of the consequences of what could happen here that we have got to stay on our game. Can't back off. Now, I've got a bunch of things to talk about. I'm going to go through them as quickly as I possibly can. There was a report that just came out. There's a beautiful, there's 2 individuals that are with us today. The mayor of Parkersburg, Tom Joyce, is joining us, on our Zoom, and so is the Chamber of Commerce president, Steve Roberts. There's a report that came out, and Senator Capito reported on it. I've been saying it, and every day, how hard and how good that we're doing as far as getting the monies out to our people. The report that was released this week by the U.S. Treasury Department says that West Virginia is 4th in the nation when it comes to the rate at which we are using and getting the CARES money out. The report says West Virginia is the 4th fastest state in the country expending the CARES funds. And we are only behind in this nation, or in this state rather, California, Colorado, and New York. And then West Virginia is right there. And this doesn't mean that we spent all the money, all the $1.25 billion. The report is significant because all states had to be measured exactly the same way by the guidelines. And so what I've been saying to you over and over and over is that, there's never a time that it can be fast enough. West Virginia is 4th in the nation in this, and that's great. There's no question it's great. It's not good enough for me. I'm the person that is telling you, let's go from 50th to 1st. First is what we want to be in West Virginia. And so I know that we can't be fast enough, no matter what we do, in getting dollars out. But being criticized or whatever for it is completely unfair. It's unfounded. It's not true. Here is a report by the Treasury Department that is just telling you and everyone what our great people have done in pushing dollars out the door and getting money into pipelines and everything that can go, ranks us fourth in the nation at it. So I'll defer, just a second, to a couple of great people, our mayor from Parkersburg and our president of our Chamber of Commerce that were kind enough to join us today, and maybe they can have a comment or two.
President Roberts, would you like to go first?
There, I am muted, and it's wonderful to be here. And those on the call, we appreciate your leadership. You're taking great notes. We are urging caution. I have someone with me here in my office, so I have reached over and put my mask on. And Governor, you can be assured we are heeding your advice, and we are urging others to. We have a Wear Your Mask campaign underway. I want to thank you for your leadership in helping with so many small businesses in West Virginia. The West Virginia Chamber of Commerce, we are privileged to have within our membership companies that employ over half of West Virginia's entire workforce. And so we hear from those companies, and they tell us that they have cash needs, they need customers, they need commerce. But of course, we say all of this knowing that number one is that we have to keep people safe and we have to keep people out of harm's way. And so we are carefully trying to balance how to do that, but we appreciate the leadership you're providing, particularly in helping the small businesses with their cash and customer needs. So that is particularly helpful and much appreciated. I'm going to say quickly, and then I'm going to move on so that we have time to hear from others. The number one thing we hear from our small businesses is that we need to work remotely, and we need to improve broadband and able to be in order to be able to do that. So, broadband, skilled workforce, workers who are able to come to work and learn and be trained are very high priorities. And as I mentioned earlier, just the needs to have cash in the door to meet the essential needs, very important. So we appreciate your leadership. We appreciate that with your leadership, we in West Virginia are doing number 4 in the country. We like it when you say, let's go from where we are to number 1. We want to be in that race with you and appreciate your leadership. And with that, I'm going to defer to others on the call. But again, thank you very much for this opportunity.
Let me say one thing, Steve. Thanks a bunch. You're a tremendous president. Of our oh gosh, I've got it all choked up here. Of the our Chamber of Commerce and all the different people that you're working with, and all of our small businesses, big businesses, and everybody. But at the same time, I want to just tell you this, that Steve, we got good news coming right around the corner on broadband. Your comments on broadband are dead on and everything, and we appreciate it. And you're going to see some more good news coming right around the corner on broadband.
Mayor Joyce.
Thank you. Again, Governor, I want to thank you on behalf of the citizens of Parkersburg for everything you do. You're not in this alone. I know that I share your heartache. Sometimes you feel like you're alone, but there's a lot of folks out here doing the right thing and pulling for you and all of West Virginia. From our standpoint here in the city of Parkersburg, the CARES Act piece, once the criteria was determined and the process was laid out, it's been really very efficient and effective. I can't say enough. And thank you, Governor, but also Brian Abraham, Ann Erling in your office has been very helpful to us throughout this whole process. Chief of Staff Hall and Secretary Sandy has just been great with regards to our first responders and personal protective equipment. The remittance from the CARES Act funds on our end has been very timely for our front-facing police and fire personnel in particular. I did speak with the sheriff of Wood County today, and I know that the county has received some funds with regards to front-facing personnel, and it's going to prove vital moving forward for us to continue our essential services, police and fire protection, and all the things that our citizens count on us and expect from us. So I really appreciate everything that you've done, and again, your staff has just been extremely cooperative and helpful. I mean, they really and it was stressful there, particularly back as we approached the end of our fiscal year in June. But again, all those folks, Mr. Abraham, Ms. Erling, they've just all been great. So we're very appreciative of the way the CARES Act has been handled, particularly these last several weeks.
Well, Mayor, thanks, and forgive me, I got a little choked up there and everything, with our chamber leader and everything, Steve and Mayor. I want to say just this, that all of us are pulling this rope, and we're doing great work. You're doing a great job, in your position and all the great stuff that's going on. You've been dealt some tough licks up there, to just tell it like it is. The fire that you had up there and all the different things, but the opportunities that how we can grow, and from all the petrochemical possibilities and on in the Parkersburg area are phenomenal. And we absolutely, but we've got to survive and get through this terrible epidemic or pandemic that we've got going on. And so we want to continue to try to push the money out. And Erling is, probably deserves an awful lot of credit, but don't forget, our state auditor and J.B. McCuskey and all the people that are really working it. I mean, there's a lot of people out there, our Attorney General's working hard at it and everything. And so Patrick and everybody, we thank everybody for all the great work that's going on, and we're just going to keep at it. I mean, that's all there is to it. We just keep at it, and we just keep, I'll never forget, a basketball coach was at Woodrow Wilson when I was probably 12 years old, in a Crescent Chipmunk, in an elementary school. And, they were playing in the state championship, and they were playing against Weirton, and it was an incredible game between two undefeated schools, and Weirton had a big lead, and all of a sudden Woodrow started coming back. I was at the game. It was in Morgantown at the old field house in Morgantown. People were going completely crazy, and at the timeouts, the basketball coach kept saying one thing and only one thing to the boys and everything, and he was pounding his hands like that, saying, "Keep sawing wood, boys, keep sawing wood." And that's what we have to do. We just have to keep sawing wood. We just have to absolutely keep pumping out all the goodness that we can do, and all stay together and keep pulling the rope together. So thank you guys. Thank you all so much for coming in today. And again, thanks. Let's just keep it going. I want to move on. I want to move on to a thing that we're going to do. As I said, I've said it a couple of times, but now we got it, and we got it moving in the way that it needs to move. It needs to move very, very quickly. But that's in regard to testing our students and our faculty at our higher ed institutions. And as they come back to our campuses and everything, we are pledging right now $2.5 million to go towards our smaller schools, because WVU and Marshall have their own plans, and they're working it great. But really and truly, what we're doing right now is pledging $2.5 million of additional money to go toward testing of those students. And, and so we will support them with the funds, and really what we will do is now defer to them as how they're going to test, and we'll pass the torch right to them and say, let's go. Let's test everybody. Let's test everybody that's going to be on one of our campuses. Now, if you got somebody that's doing, virtual learning at a distance, we sure don't need to call them in to get them tested. That could even cause a bigger problem. But anybody that's coming to any of our campuses, in-state, out-of-state, it doesn't matter. We test everybody, including all the faculty and everybody else. And we're going to pledge the dollars to be able to accomplish this. And then we're going to turn it over to our schools. And we have a lady with us today that's doing a great job at Fairmont State. Her name is Dr. Mita Martin, and Dr. Martin is with us, and she's going to say a few words, and we're tickled to death to have her here, and we're just proud as we can be of Fairmont State, and we just want them to keep on keeping on.
Thank you, Mr. Governor. Good morning, sir. On behalf of West Virginia Council of Presidents, which is comprised of all of the public colleges and universities in West Virginia, it is my distinct honor to bring you greetings and to express our gratitude for your support of higher education. While this pandemic has been the defining event of our lifetime, you, Mr. Governor, have brought optimism, vision, and heartfelt care to West Virginia. Your leadership has guided our state by putting vision into action, and we're so very grateful. Sir, we know that you are a passionate advocate for our institutions and for the importance that our universities and colleges are as avenues of life-transforming opportunities for our students. And so today's announcement that you have earmarked funds to assist us in testing all of our students, faculty, and staff is evidence of your resolve to place the needs of our state and of our institutions first. I consider myself very fortunate to live in this great state. Governor Justice, on behalf of West Virginia's universities and college, please accept our very heartfelt and sincere gratitude, sir, for your support and for the monumental assistance that you have afforded us today to test our students, our faculty, and our staff. God bless you, sir. Thank you so very much.
Dr. Martin, God bless you, and God bless Fairmont State. God bless all of our higher ed institutions, and let's just keep moving in a way that we can do this as safely as we possibly can. There's a lot of different plans that are in place. I've got all the confidence in the world in you and all the people that are putting those plans into motion, and so just keep it up. We all know that we want to go back to school, but we've got to do it right. We've got to do it as safely as we possibly can. We've got to protect our students. We've got to protect our faculty, but we've got to protect our communities. We've got to protect all that are around us. And so we want to do it and do it right. And I hope and pray this is one step forward to trying to do it right. But thank you so much.
Thank you, sir.
Now, if I could go on to just a few more announcements and everything, we still have outbreaks in churches in only 4 counties now, and that's down from 8 to 6 and down to 4 now. But those are in Mason, Grant, Logan, and Taylor counties. There's a total now, that these 4 counties account for 87 of the 131 total cases. Again, I strongly encourage, gosh, I sound like a broken record, don't I? I strongly encourage in every way, we all know that church is a setting that we cherish in every way. Maybe the number one thing, and yet we've got at church to wear your mask or wear a face shield. We've got to absolutely keep the social distancing in place. We've got to have a pew in between us. We've got to just do everything we possibly can, because just think, as I read through these numbers, number after number after number, especially is primarily our elderly, and our elderly community is surely an awful lot of our churchgoers. So please hear what I'm saying. This is tough enough to sit here and call out 5 West Virginians that have passed away because of this terrible thing. But it is only a fraction, and I know it's just a fraction of what those families are feeling. I know that. I'm trying to be respectful to those families in every way, but I know my words and my stress and problems with calling those out are only a fraction to how bad the families are hurting and all those people's loved ones. So please keep them in your thoughts and prayers. Be safe, West Virginia. Come on now. Our small business grants are moving. They're moving really good. I urge, people to continue to apply. We need more and more and more people to apply. We're still working really hard to find a way. JB and Ann and so many are working to find a way that we can bring, into the program, those that are not technically an employee, but they're making their living, as a sole proprietor and everything, and they're making their living on the profits of whether it be a barbershop or whatever, and they're the only person there and everything, but they're not paying themselves as an employee. It makes it really difficult for us to track, and it makes it really difficult for us to be able to prevent fraud. And you've got a lot of people out there that are preying on these systems. We hear it every day. We hear it all across the news and everything. We're trying to not send our money, to somebody that's doing something illegally, and so nevertheless, we're working on it, and I continue to tell everyone that is from 1 to 35 employees apply. Our free testing is still going on this week, and it's going to be going on this week in Gilmer and Marion County. Next week, it'll be in Hampshire, McDowell, and Taylor counties. It's available to all and everything, especially our minorities. It gives us more and more and more information. It's just what we need to be doing, and I commend all those from DHHR, local health departments, the Guard, everybody that's working this, and heavens to be it, it's a big deal, big stressful. It's pushing us to the max, but that's what we want to do. None of us are going to rest till it's over. As far as our grants, we've talked about that. We've pumped out now in excess of $63 million have been awarded to 160 cities and counties. We've got to have more people apply. We're continuing to push the money out the door and everything. The Treasury Department, you see, reported that. That came from surely nowhere that I had or anybody in my office knew about, and all of a sudden it's here. We appreciate Senator Capito, bringing that up on Hoppy the other day, and we just needed to further explain what we're trying to do in West Virginia. As far as our summer feeding map, it's up. We now have the 696 sites. We absolutely don't want anybody in West Virginia to go hungry. If you have an issue and you're having a problem, either call us or call 211 and we'll direct you to how you can get the proper food and everything. As far as our census, I always want to remind you about that. Get counted, West Virginia. Get counted, get counted. I mean, for crying out loud, that's dollars and dollars that come to us. And the other thing I would tell you, I'll just go to our charts just real quick. If you look at the top, we have now got 4,750 people that have recovered, but we have 1,712 people, and I think that's correct and everything, but that now are active cases. We need this to really widen. We're testing a lot of people. We've got a lot of people that we're treating as active cases are recovered. We want to keep that going in the right direction. You've got to listen to me, West Virginia, that this thing is here anyway. The transmission of it here anyway. But we got a lot of people that are traveling to the South and everything on vacations and everything and coming back. And a lot of people are completely don't have a clue in the world that they have this. They got it. And now we got a real problem, a real big problem. This is not only just migrating from the South on people that are going on vacations, but it is migrating from the South because of just simply the pure numbers. What is the likelihood of someone driving over from a bordering state like Kentucky that is 4 miles away? And what is the likelihood of that if Kentucky was really, really, really low? They're a barrier to us. They are blocking it coming from Alabama or Tennessee. They're blocking it for us. But now Kentucky is covered up with it. And now Ohio is having a problem. These people, this is coming from the South. You see what's happening in Florida, and I've beat that horse to death, but you see what's happening in Florida. It's amazing. They have 2.5 times the number of deaths in the state of Florida yesterday. 2.5 times the number of people died in Florida yesterday as have died in West Virginia in the entire time. I'm going to say it one more time. 2.5 times as many people died yesterday in Florida as have died in West Virginia since we had absolutely started with this. You know, West Virginia, our nation has a real problem going on right now. And I really would hope and pray that you would put up prayers for our president and all of his team and all those that are fighting this situation, from governors right on down all across our country. We're fighting a monster here, and the monster is killing people every day. And there's no playbook. No one's ever seen it before. We're trying to stop it, and we're trying to go on and keep our economy moving, and all of this is one tough balancing act. So, West Virginia, do your part. Do your part. Let West Virginia be the block. Let West Virginia be the stopper. Let West Virginia continue to be the miracle, and stop these trend lines from going the wrong way. That's all I got. Thank you again, West Virginia, and thank you for those that joined us today.
Thank you, Governor. Let's now go to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. Let me talk in a little more detail about the Princeton Healthcare Center outbreak. A lot of discussion about that in social media and print. I said earlier in the week that without sports on TV, that it seems everyone's pastime is to be an armchair epidemiologist. That's not as easy as it seems. I am certainly not an epidemiologist, but what I'd like to do is walk you through the timeline with regard to that outbreak. I want to show you that timeline. This is directly from the outbreak report that the regional epidemiologist and our head epidemiologist walked me through last night. So, Jordan, can you pull up that slide, please?
It's up.
Thank you. I hope you can see that. Try to make this as simple as possible. Again, the reports are done on every outbreak in the state. They include confidential information. So this is a summary of the exact dates and language from the outbreak report. If you notice, the first date is June 30. The June 30 date is when DHHR was first notified of a positive case of an employee at Princeton Healthcare Center. That was a confirmed case. The employee was asymptomatic when tested, but had not been in the facility prior to July or subsequent to June 21st. So this individual was not deemed to be a risk in terms of spread in the facility. Nevertheless, we contacted our health command, contacted the facility. They did their own testing on July 1st. So again, that was arranged immediately, arranged the day after the notification of the positive, and that began at 7 a.m. that morning. That testing was completed and specimens sent to LabCorp. On July 4th, some test results came back, and that was when we identified an additional positive case. Again, that employee was asymptomatic. That employee was sent home, and one other employee was sent home. So I want to say this, and I'll probably say it several times. The nursing home did a beautiful job, terrific job in trying to make sure that patients were kept safe and employees were kept safe. On July 6th, there was a follow-up with the EPI. There was no additional cases at that point. On July 7th, all of the returns, all of the reports were received. In all, 188 staff were tested. with 187 negative, and as I said, one positive test that came back on the 4th, and 102 patients were tested. All were negative. Go to the next slide, Jordan. So on July 9th, the regional epidemiologist did follow up to determine whether there were any updates, any changes with regard to the population, the patients and the staff. On July 13th, follow up, no additional cases. A note in the report is that they will monitor through one incubation period. On July 15th, right as the file was ready to be closed, an additional employee had symptoms, was again immediately sent home. They were tested. While waiting on that report for that individual, a patient who was transferred to a hospital did test positive. That was on July 17th. Keep in mind, all previous tests were on July 1st. The employee who had symptoms, by the way, did end up testing negative. But the July 17th patient was the second, actually a new patient tested positive, and as I mentioned earlier, was traced to travel. It was a different source of the disease than the initial employees on July 1st. So on July 17th, we notified DHHR Command, spoke with them, made immediate arrangements to test again. So we tested then again on July 23rd, all patients and all staff, and just completed other testing, additional testing this week on July 28th. All right, thank you, Jordan. The first two cases in this in the facility were identified on July 1. The administrator and staff did exactly the right thing by sending employees home and isolating. These were asymptomatic employees. They did what they needed to do to protect their patients and their staff. I've spoken to the administrator several times, including this morning. I think the fact that the administrator wanted additional testing on the 7th, and remember the 7th was the day that the remaining results came back in, so we had just received all of the results on the 7th. But I think the administrator wants to make sure that she and the staff could do everything possible to protect their patients and protect their staff, and I understand that. In this case, testing was not necessary, according to the epidemiologist. Regional epidemiologist was following these cases very closely. Our regional epidemiologists work incredibly hard, as well as those in the local health department. So the timeline between the first two cases was 15 days. These were the source of these two individual outbreaks were separate. They were different. We found that through contact tracing and through discussing the source. So the arguments in the press or the discussion in the press that something was missed is inaccurate. It is not true. So as the governor says, run to the fire, we did run to the fire. And we did, our staff did, and the staff at the facility did exactly what needed to be done. Additional testing on the second source, the second positive case was done on the 17th, on the 23rd, and on the 28th. So we have been in constant communication with the facility, with the nursing home, and trying to make sure we provide all support needed. The National Guard is, I believe, is down there today in terms of education with regarding PPE. We've offered additional PPE, and we will provide that as needed. I believe we've already provided a significant amount down there. So let me just say, DHHR works hard. We have worked very hard to be open and honest and transparent, and we will continue to do that. We will not always do everything right. Those folks who work with me have heard me say, if we make a mistake, we admit it. We own it. It's ours. We'll fix it. And we'll fix things so that hopefully we don't make that mistake again, which we've done a couple of times in terms of our policies and how we move forward. What I'm not okay with is bringing politics into the middle of a pandemic. It's wrong. It's unconscionable. And I will not allow DHHR to be used as a political tool, primarily for the governor and our staff. The governor doesn't deserve to have DHHR used as a political tool against him. I know of no other governor that's done more to protect the elderly population, the nursing home population in the country. We have done everything that we could do as rapidly and as quickly as we could do it. Again, we have not always been right, and we've not always been perfect, but we will admit it when we are wrong. In this case, everything was done right. So I understand the need for information. I don't do social media. These things have to be brought to my attention. And it wasn't until late last night that I was able to go through the entire file with the 2 epidemiologists. But I understand that these are emotional times. These are scary times. People are getting sick. People are dying. More West Virginians are dying, as the governor said. Asking our staff to take hours and hours of time to go through files and try to justify what they've done or provide support and documentation for what they've done is sometimes necessary. Sometimes it's not. Again, our regional epidemiologists have some of the toughest jobs in the state right now. They're under great pressure to do the right thing. In this case, they did do the right thing. So I have nothing but praise for our staff. And I also, again, want to thank the Princeton Healthcare Center. They did everything right. And I understand wanting to do more. I understand that. But we did do what needed to be done. The first 2 positives were taken care of and followed appropriately. And then there was another based upon travel from outside the area, as the governor says, from down south. We had another positive case. So again, our numbers are going up. Hospitalization is creeping up. Deaths are creeping up. The only way we're going to get through this pandemic is working together. Local health departments, facilities like Princeton Healthcare Center, correctional facilities, rehabilitation facilities. We have group homes with outbreaks. We have we're approaching 200 outbreaks in the state of West Virginia. So we need assistance and cooperation from everyone, and we try to be cooperative. So again, I hope that explains what happened, how it happened, and again, I understand the concerns. So I appreciate the time. Thank you.
All right, thank you, Secretary. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's good to be with everybody. I will keep my comments short. In the time of this press briefing, our new RT value came back, our reproductive number, and as the governor said, it had been 1, but today it's 0.97. So we've gone from red to green on that assessment tool, and that's gives us encouraging hope for a reduction in the future of some of these cases. We know that number tends to precede the number of cases, number of hospitalizations. But I think, as the governor said, we're seeing all over the country a spread of COVID-19. Remember, 99 days for the first million people, 43 days for the second million people, 28 days for the third million people, and 15 days for the fourth million people infected in the U.S. And we talked before about that dying is not the only outcome that we're worried about, because more and more we're seeing some perhaps more side effects of COVID in the short term and 2 to 3 weeks after the infection, and even longer term where we might see more problems long term with people infected with COVID. And we're particularly worried about our young people that have tended to be the source of this expansion. The one thing I will say that I think is really important, people have noticed in the news, there's been more and more reports of smaller outbreaks, of 100 people or so in some of the countries that have been very committed to wearing masks. And some people have interpreted interpreted this to say, well, masks don't really work. But if you look at these countries, they've had a massive reduction in cases and deaths, whether you adjust it for the population or you just look at raw numbers. Really, really impressive. And we've been through a lot of that data. The thing, I had the benefit of talking to somebody last night who's really an expert, who's at the University of Minnesota, a gentleman who's a doctor, Michael Osterholm, and he's a person that predicted this outbreak many years ago, back in 2005. And what he said, which I think is really clear if you really get down deep into understanding what's going on around the world, is that we cannot become lax on wearing our mask, but also maintaining that physical distancing. The physical distancing is another important partner effect with wearing a mask. And more people are realizing that maybe part of the virus gets aerosolized, which are smaller particles, and those particles are much closer to be spread from the person who might be infected. And so keeping that 6 feet of physical distancing and mask really work together to protect us. So that's something, as we are really encouraging all of you, West Virginia, to continue and wear your mask, faithfully, because it does make a difference. Also maintain that physical distance from others who you don't live with all the time. So thank you so much.
All right, thank you, Dr. Marsh. Major General Hoyer with the West Virginia National Guard and Dr. Ayn Amjad, our state health officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today is from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Question for either the governor or Secretary Crouch or both. What were the lessons learned at the Jackson County Elder Care Health Facility? What was the importance of those lessons learned and either the failure to respond or the failure to communicate between DHHR and the governor's office? Did those play any role in how you guys attended to the problem in Princeton with the facility there? Because obviously those two situations, and really every situation in nursing homes in West Virginia, has been handled very differently than how Jackson County was handled. And just as a follow-up, how close are we to getting the final report on what happened in Jackson County when we can figure out what the administration has discovered about that? Thank you.
Okay, Secretary Crouch, let me kind of lead off and just say just this. The situation in Jackson County, and I think you'll follow up in the same way. The situation in Jackson County, in my opinion, could have been handled lots better than what it was handled. And it just to tell it like it is, it was kind of in the beginnings of where we are today. I totally understand when the outcomes are not just perfect, not from the standpoint of what we did or what our people are doing, but from the standpoint if the outcomes are very unfortunate and you basically have people die, or you have the spread significant, then really and truly, I would be in the same boat. I would be one that would be saying, why didn't we do this or why didn't we do that? Especially if it were one of my loved ones. So it's totally understandable. But I want you to know just this, that from Jackson County to today, and even prior to Jackson County, where did I stand? I stood and stay in the same position, and that is just this. We absolutely, every single one of us, should always stay on red alert to try to run to every rescue or run to every fire. Now, at the end of the day, in the situation in Princeton, as I've been briefed, and you've heard from Secretary Crouch, Other extenuating circumstances are happening, additional infections that are coming from additional places and all that. Additional curveballs are coming. But if Secretary Crouch is exactly right, then what we need to do is we need to absolutely understand that these great people from the health situation, from all the local health departments to the DHHR, to the Guard, to everybody, they can't be expected to be perfect. They're not going to be perfect. You know, they're not going to be perfect in the final outcome. They may do every single thing just perfect. But in this situation, you know, as far as testing and everything, the situations that's going on at Princeton and Jackson County, it's very difficult to compare. It's a lot different animal. But Secretary Crouch, if you'll take over, please.
Yes, sir, Governor. Thank you, Kenny. I'm happy to respond to that. First of all, the last thing I mentioned in talking about Princeton was we have to have cooperation. We have to work together in these situations. Princeton was absolutely, totally cooperative in their efforts with regard to testing, and in fact wanted to test more when it was not indicated. It was a different situation in Jackson. I spoke to the administrator just a few days before they did do the testing. The governor's order, as he says, this is kind of it. Jackson County did change some of the things that we do. The governor entered his order on April 17th. That's when we had an official order to test everyone. Prior to that, nursing homes are private entities, and they made decisions whether or not to test. And in fact, prior to the order, they had to pay for that testing. So that impacted some providers, some operators, owners' decisions whether to test. Clearly, if you had a positive in a facility, you have to test. Some facilities were only testing one wing. So it did change. The governor took a hold of that situation and said, we're going to test everybody. If we have one positive in a facility, we will test everyone. In terms of DHHR not providing information to the governor, I take great exception to that, Kenny. That is not true. It absolutely is not true. And any indication that I didn't follow the governor's orders is totally false, totally false. In fact, the memo or the email that you waved on the screen that had two highlights on it also had the number of positive cases by staff, the number of positive cases for the residents or the patients in that facility. That was dated the 13th. It had a huge amount of information with regard to what was going on in Jackson County. So that was sent to Brian Abraham and Bray Carey. So I tried to make sure the governor's office was up to date on what was going on in Jackson County. That's our job. So again, happy to discuss that in any detail you would like. I was not asked to be interviewed for the story you did. There's clearly information out there that shows what we did to try to communicate with the governor. But the bottom line here is the governor really saw this as a reason to take this situation in hand. He entered into an order. From that point forward, we've led the country in terms of testing nursing homes and making sure nursing home residents are safe in this state and employees as well. So thank you.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, given the fact that the numbers continue to rise, all of these metrics that we're looking at continue to worsen, at what point are you going to consider reimposing restrictions such as further lowering the public gathering limit, reinstating the mandatory quarantine from people coming out of state? At what point do we need to take some steps backwards? Thank you.
Charles, this is an ongoing process. Without any question, we're watching the numbers and we're watching every day and we're consulting with all the experts and we're doing any and everything that is within all of my capabilities of mental capabilities, physical capabilities, contacts, everything that I know we can do. Now, Charles, without any question, those things are absolutely on the table. And it may be that we need to start backing up in a more aggressive way, and that may absolutely come to pass and everything. I hope and pray that we don't have to go there from the standpoint that we just don't have the bad numbers continue. But, Charles, we're not there yet. But each and every day that these numbers keep creeping up, we get closer and closer to being there. And so there's no question about every day being a challenge and everything, but at the same time, our people are doing it and they're doing it right. And but Charles, your concerns are valid and my concerns are exactly the same. And that is just this, if these numbers keep heading the way they're heading, we're going to have to do more stringent things and take more things back away in order to try to some way slow it down and stop it. Because if we don't, we're going to awaken to a situation that is really bad. Now we can do that and we can stop it and we can slow this down if we are all pulling this rope together. That's why I've said over and over, we don't need to be Republicans and Democrats. I don't care about the election process and everything right now. We don't need to be Republicans, independents, and Democrats. We need to be West Virginians, and every last one of us in regard to this need to be pulling the rope together. That's what we've done. That's how we've stayed together. I'm not going to sit here in any way and defend anything. If someone's done something wrong, then absolutely I want them to stand up and I want to correct it or do whatever needs to be done. But I'm not going to sit here and try to cover something up and defend. There's no way. Everyone knows, everyone knew in the situation with Jackson County, I'd said over and over, if we have an outbreak of one person, we need to run to that fire. In Jackson County, we followed CDC guidelines. We didn't follow my announcements and my feelings. We should have run faster. We were trying to do it within the guidelines, and you can't really fault that. We were trying to do it in a way that was different than what I wanted to have it done. But in regard to Princeton, absolutely, to my knowledge and everything I know, we did what we were supposed to do, and we're going to continue to do just that. We have done amazingly within West Virginia in regard to our nursing homes, and we need to just keep on doing it. But Charles, I am just as concerned as you are, and I'm going to stay that way. And if we got to back up more stuff to slow this thing down, we'll sure do it.
All right, thank you, Charles. Next, we'll go to David Beard with the Dominion Post.
Hi. Some local small businesses came to me with a question and a couple of requests regarding the small business grants. The context is they say they are unable to work through OASIS to apply, register as a vendor, and so they can't apply for those $5,000 grants. Their question is this widespread around the state? And their requests are two. One, they'd like to see if you could set up a hotline directly to the governor's office to help them with this problem. And two, and I had to check my note because I don't remember the second request, is, could you deploy more resources to OASIS so that this can be expedited? Thanks.
Okay, Dave, let me try to answer this. I think I can answer it pretty quickly. I think we have two hotlines already set up. They've been set up, and one at the auditor's office, and one that is a problems hotline here in our office. Please let people know to call those hotlines if they've got a problem. And I understand from the standpoint of OASIS, we have staffed up additional people there, to be able to help and everything. And through the auditor's office, they're staffing up as well. And we're trying. I understand where people, maybe having a problem, getting on the computer, going in, doing all the stuff and everything, just call us. Just call us. We'll walk it through, and if we've got to have 14 hotlines to be able to process and help the people that are out there that maybe aren't computer savvy and everything, and they're having trouble with Oasis and everything, just call us. We'll walk you through it. We'll get it done, and I don't care if we got to have 2 or 14 or 25, whatever we got to have to help our people to be able to understand and be able to get qualified and get these dollars out to them. We'll do whatever we have to do.
All right, thank you, David. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet and fellow reporters. Governor, as you probably know, your political opponent, Ben Salango, held a news conference this morning, and he says there continues to be a discrepancy in the numbers of active cases or reported cases. He said in Kanawha County this morning there are approximately 303 cases. The number you gave was 277. Is there still a problem in counting and getting an accurate total of the cases, especially given the fact that your previous public health officer lost her job because of a continuing problem with numbers disparities?
Well, Mark, I would tell you just this. There was more things than just that. And from a standpoint of confidence and everything, I feel like that we had to move, and we moved in the proper way there. But as far as Kanawha County, and there are issues with the Kanawha County, having problems, moving stuff, within, and maybe our secretary can better explain the Kanawha County discrepancies and everything. He can do that better than I or Dr. Amjad could do it. Our DHHR and GARD are trying very, very hard to work with them. They're great people. They're doing a great job and everything. We've just got some kind of lag and some kind of disconnect there. I don't want the Kanawha County people to think that I'm not right on their side and everything. I am. I am no more on the side of our DHHR and GARD than them. I am very supportive of them, and I want us to true up and everything as best we possibly can. But the situation there is way, way, way insignificant to the situations that were going on before. But Mark, to answer your question even more bluntly and everything, for this to turn into, my political opponent is looking for, just grabbing at straws and everything. This doesn't need to be this. For crying out loud, our people are doing a really good job here. We don't need to get this into politics. I complain about that every day. It's just, it's silliness, to tell you the truth.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. I'm still trying to kind of clarify the Princeton health situation in my mind, so this may be a Secretary Crouch question. My understanding of the nursing home's position on this is that they asked for state help in instances almost a month ago now where they had one case at a time. And at the time, the state policy was you don't necessarily get mass testing help from the state until you've got 2 cases at a time. Has that policy changed? And essentially, do I understand the gist of what is being said here? Still trying to seek clarification. Thank you.
Secretary Crouch, let me just say just this. I was listening to Secretary Crouch. He's trying really, really hard to give you a timeline. It gets confusing. It's confusing to listen to Secretary Crouch and listen to all the different stuff that all the health people and everything are going through, and it's confusing even to me. But from my standpoint, it is just as simple as mud, and that's all there is to it. If we have one person in a nursing home tests positive, we need to be running to that nursing home. That's all there is to it. I think in this situation, that the secretary could speak for himself and everything and speak for what we did, But from my standpoint, I don't know how to be more emphatic and more absolutely on point. If we've got one person, we need to go, and we need to go right then. But Secretary Crouch, go.
Yes, sir, Governor, and that is what we did. Thank you, Brad. Let me see if I can make this a little simpler, and it is complicated. These investigations and the contact tracing that's done to make sure we understand who might need to be tested or who might need to be isolated, it can get very complicated. Let me see if I can simplify this. There was one case identified on June 30th that was positive. That employee was asymptomatic, had not been in the facility since June 21st. So that individual was asked to isolate, did not come back into the facility, so was not a risk from the standpoint of spread in the nursing home. So you can kind of leave that one aside. The next case, and so what we did though, as a result of that one positive case, as the governor said, run to the wire. We went and made sure, contacted the health facility, the Princeton nursing home. They wanted to do their own testing. At 7 a.m. the following morning, which was July 1, they tested everyone. One additional case was identified on July 4th. Additional isolation, that individual was asked to go home. So that's the only case you really need to consider. If you look at our 14-day window where we have somebody isolate or self-quarantine for 14 days, that's when that individual, if they're asymptomatic, moves to a recovered case. It could actually be sooner, but we do 14 days, like I believe that's CDC guidelines. So that case that we were watching really ended around the 15th of July. And remember, the next positive case was the 17th of July. So it was unrelated. The contact tracing identified that source as a situation, someone traveling from down south, unrelated to the first case. So if we had seen a need to test on the 7th, and the date of the 7th kept coming up as the nursing home wanted to test further, we didn't even have all the test results in from the testing done on July 1st. I've got some on the 4th. They got some, and we got those as well on the 4th. And then all of those results on the 7th. So to turn around and test again on the 7th, when we just got the results in and we have one asymptomatic employee who has been sent home, we did the testing for that, and the epidemiologist wanted to watch that and see what happened. That was the right decision. DHHR did everything right. It was the second case on the 17th that was from a different source. So I hope that clears that up. It's really two different, you can consider it two different outbreaks from that standpoint. Certainly the sources for each of those positive cases came from different people.
Brad, let me add one more thought. And you know, I love listening to our experts, especially from the medical field, because, you know, they're on a different plane probably than I am. You know, from the standpoint they're super smart. They absolutely, you know, are dedicated to their profession. They are trying as hard as they can to answer your questions and dot every I and cross every T. Sometimes, really and truly, their extreme intellect gets in the way because it makes it difficult for any of us to understand as they're processing. But thank God for them. Thank God for the science and all the stuff that they do. But I can tell you this, in the Princeton situation, the way I see the bottom line is just this. We have now tested, since that first initial notification, we have tested, I think we are on the 4th go-round of testing, you know, from the standpoint of testing the entire population there or they're close to that and everything. And understand also that this works through this. This works first through the health departments there. And then as it flows then through our DHHR and then through all the effort of the Guard and everything that's going on. That, to me, is the bottom line. The bottom line of this thing is if you'll just follow the whole process, you'll see that absolutely, when we were notified, I hope and pray that we did exactly what I've said to do, run to the fire.
All right, thank you, Brad. Next, we'll go to Jade Burks with WVVA.
Hey, good morning, everyone. I'm also a little confused about the Princeton healthcare situation because it's been said the argument in the press is inaccurate, but PHCC itself in their daily COVID updates say they haven't received any assistance from the state other than education and PPE. So are they going to be receiving assistance when it comes to testing, or can they expect that? Like what can they expect? What are they going to get?
Okay, wait, time out. I'm gonna defer, but just time out. I mean, for crying out loud. I have said this 14 times now. You know, what do you mean all that they've received? They've received some PPE and they haven't even received whatever and everything. For crying out loud, we've got people that are covering up that place doing testing, and this is on the 4th go round. But nevertheless, you know, please, you know, Dr. Amjad or Secretary Crouch or Dr. Marsh, y'all answer it.
Yes, sir, Governor. This is Bill again. I couldn't quite hear all of that question, but we do. Our documentation is much better than it was when we started. We contact facilities the day of the outbreak, and we offer services. We offer PPE through the Guard, and we coordinate very well with the Guard to make sure that they have what they need to do that. I believe we had a very large order go back to the Princeton facility earlier this week. So we are providing all of the services, all of the support we can for anyone that has an outbreak, and that's not just nursing homes. It's all entities out there. We are trying to coordinate this and we're doing a good job at that. And I will say again, I want to thank the Guard because they're a huge part of this in terms of delivering supplies. We had as an example, we had a lab who was supposed to overnight supplies, and we had an issue with that a couple of weeks ago. They did not get overnighted and did not get there when they were supposed to. The Guard picked up supplies and drove those to the facility. So we're doing things like that to try to do what we can to make sure that things get done. The fact that didn't happen, we changed our policy so that now we have we make a call to make sure when supplies were supposed to be overnighted or test kits, we call to make sure they got there. If they didn't, then we can make other arrangements. So we really are doing, I believe, everything we can to try to support folks in the communities.
Weigh in, and at least tell them what you guys have been doing. General, did you hear what I said, General?
Yes, sir, Governor. I had to get it off mute. Sorry. So on Monday, we were contacted by the governor's office to assist DHHR in addressing the situation in Princeton. We made contact with the folks at the nursing home and DHHR that next morning on Tuesday. It was determined that the nursing home had the appropriate number of people to do the testing and swabbing that they needed. But in the afternoon, it was determined that the National Guard would then provide PPE supplies, which went out, I believe, that day. And the next morning, PPE training support to the nursing home facility. That next day on Wednesday, today, there are members of the National Guard subject matter expert team at the facility, walking through the facility with the folks at the facility to look at other things that could be done in the future related to environmental issues that may be helpful to the facility, to include any sanitization or cleaning that might be needed. And all that's being done in coordination with the facility as well as the DHHR staff.
All right, thank you, Jade. We have time for one more. We'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Going back to the CARES Act funding for a tiny bit, I know the line that keeps being said, I think from Senator Manchin and from your opponent Salango, is focusing on the 45% that's supposed to go to cities and counties. They kind of make that out to be a requirement. I sort of am under the understanding that that is not a requirement, a recommendation. And considering the amount of money that's gone out and the number of applications that have come in so far, it would seem that that'd be a hard target to hit anyway. So I guess my question would be, I mean, you've read the U.S. Treasury requirements. You've got people advising you on that. Are you supposed to be giving this money out basically, in big tranches to every county and every city in the state, or obviously you guys are doing the application process and trying to make sure that all the reimbursements are reported. So which way is how are you supposed to be doing that versus what they say you're supposed to be doing it? Thank you.
Okay, Stephen, here's the bottom line, the whole thing. You and I both know that these are just political moves to try to gain some kind of traction and to try to get some kind of attention. From Salango, it is beyond belief inexperience of a young guy that doesn't have a clue in the world what he's talking about. From the standpoint of Senator Manchin, it is basically what I've said already before. It is trying to perpetuate, Salango's gubernatorial campaign. The bottom line of the whole thing is just this: there are rules out there. There are rules that counties have to apply and guidelines on what how they can receive dollars. Absolutely, from the standpoint of the 45% that's out there as a potential per se guideline, it is not a rule. I mean, for crying out loud, and Senator Manchin knows all this. We know all this. Absolutely. You see what's happening with other states all across our country from the standpoint of the Treasury report that just came out. West Virginia ranks 4th in the nation in pumping the money out on the CARES Act to where we've sent the dollars. And we continue to do just that. We can't send the counties something, just bundles of money because per se somebody on the outside may say, well, why don't you just send, why don't you send Kanawha County, $182 million just for fun? They've got to meet certain guidelines, and that's what we do. That's what this thing's all about. If Manchin wants to change the rules of the game and everything, I've said it over and over and over. Joe, just do your job in Washington. We're doing our job in West Virginia. The report clearly says that. Joe, do your job in Washington. I've pleaded over and over that we want to be able to backfill revenue. We have asked over and over and over to do all kinds of different things like that. We can't do that right now, Joe. You know the rules. For crying out loud, Stephen, it is the silliest questions in the world. That's why, to me, it's nauseating. It is absolutely nauseating because it's political. It's all political. That's what it is. Stephen, we had 5 more people die today. Stephen, absolutely, West Virginia's numbers are still tracking in not a great way. Stephen, we've got people that are sitting around right now that don't know what they're going to do from the standpoint that they're waiting for their unemployment, and those people in D.C. can't get it across the finish line. Stephen, tell them to do their job. We got people here that are hurting in every way in the world, and West Virginia is being managed and managed properly. The report clearly says that. Does it not, Stephen? I can't do more with dollars that are prescribed with guidelines than what I am doing. And that's what I'm going to continue to do. I just wish to God above that we would stop this crazy politics. Just do our jobs. Just do our jobs. And our job is number one, to do any and everything we possibly can to help serve West Virginians. You know, I mean, come on, Stephen. Jiminy Christmas. You and I both know exactly what the problems are. You know, they need to do their job in Washington, and if they're not going to do their job, there's no point in them running a political campaign in their state. You know, it's not what we ought to be doing.
All right, thank you, Steve. I'll turn it back to you, Governor.
Well, you know, I don't really know that I have a whole lot other than what I said when I led off by telling you that I would come back to our mask. You know, I don't like this thing, and I know you don't like it. But I would tell you, pray tell me what other bullet in the gun we got. What else do we have? What else do we have today? Other than starting to shut down everything coming or going. You know, absolutely, this mask that can protect us and at least give us a shot to get through this. You know, the bottom line, and I've said it over and over, I'm not a lifer politician that has had a government job and has become rich on your tab for it. Look at the politicians that are rich and ask yourself point blank, how in the world on the salary that they were supposed to receive, how did they get rich? How did that happen? It's happened all over our country, and it surely happened right here. How does that happen? Well, it happens by every hot tip or slick deal or whatever you want to call it. It happens. But you see, I don't want anything. I have never wanted a thing. All I want is goodness for West Virginians. I don't want a thing for Jim. Now, I worry myself sick about you because I know just how bad this situation can be here. I plead with you every day to wear this mask. I don't know what else we can do other than shut stuff down and put you back in your houses and all of us stay there. And then it'll get somewhat better. It won't get completely better. And we'll sit there and devastate our economy and devastate our finances personally. And we'll sit there and absolutely just wither. Wear your mask, West Virginia. It's really the only bullet we got in the gun right now. Wear your mask. We're going to continue to watch the numbers. I promise you to God above in every way under the sun. And I am an absolute devout Christian, and that is really significant to me. When I tell you the only thing I want is goodness for West Virginians and all this great state, it is legitimate to God above. Absolutely, West Virginians, please know that I care about you, I love you, and absolutely I just want goodness for us, and I want to try to protect you with all my heart. I wish to God above we'd stop this crazy politics stuff. It's not good for us. It's not helping us. But nevertheless, I would say to you, wear your mask, look out after the elderly, take care of people, go get groceries when you can for people. Try to step up and help anybody and everybody that's your neighbor. The good book above tells us in every way exactly what to do. So all I'd say is I love you, God bless you, and let's get through this. We will. Thank you.